Hi, welcome back to Rebel Health. I'm Dr. Ellen Vora, a holistic psychiatrist based in New York City, and a video of mine came out a little bit ago about, I think I titled it Benzo Withdrawal Equals Despair, and I talked about how we, especially as doctors and just as a public, underestimate and underappreciate just how difficult it can be to get off of benzodiazepines, and that they can create a really severe withdrawal that can feel like intense discomfort and despair and hopelessness, and can really be crippling and incapacitate people for months and sometimes even years. So this video, of all the different videos I've come out with, seems to really have hit a nerve, and a lot of people it's resonating with a lot of people. And so I think I want to now offer up some suggestions for if you're one of the many people for whom that video resonated. Here are some things you can do to help your withdrawal process. This, of course, is not a substitute for being in care with your own psychiatrist, someone who is guiding you on this process, someone who understands where you're at, because it's very individual and everyone's in a different spot, and it can be dangerous and it can be difficult. But at least hopefully this can give you some guideposts of things you can do to support your withdrawal process. One thing is to taper extremely slowly. One thing is to make sure that you have a community and resources and a forum of people talking about this, not just doctors, but people with the most important credential, which is people who are going through this or have been through it in the past. Communities like Surviving Antidepressants or Kelly Brogan's Vital Mind Reset group, or just checking in with things like Inner Compass and Beyond Meds and all these different places. Mad in America is also great. I think that nutrition needs to be that's the cornerstone. So you want to make a priority of feeding yourself good food, nutrient-dense food, non-inflammatory food. You need to eat enough. You need to get plenty of fat, plenty of protein, plenty of carbohydrate, lots of vegetables. Your body never wants to get that signal of you're hungry or you don't know where your calories are going to come from. You need consistent blood sugar and abundant nutrition. Sleep needs to be the other priority. So much rest. And you can think to yourself, that's too much rest, I'm sleeping too much, but you need to sleep more than usual as you're going through this process. Your body is working hard to rebuild and reconstruct, and it works best when you're asleep. And so expect to need to sleep more and make a priority of sleeping. After that, I think that you want to have some detoxification practice built into your life, and that's a little different for everybody. Some people like infrared sauna, some people like coffee enema, some people dry skin brush, some people oil pull, people have other practices too, some people jump on a trampoline. Whatever floats your boat, do it, but have some regular practice that just helps your body get whatever metabolites it's forming up and out. And then some amount of either meditation or something that helps put you into a relaxation response every day. Kelly Brogan has people do at least 3 minutes of Kundalini meditation daily. That's very powerful and a very efficient way to put your body into a different tone in your nervous system. Some people like headspace or mindfulness meditation. Other people have a regular acupuncture treatment, or all different ways of putting your body in a relaxation response, but it's got to be something. And then I think to be patient with yourself and recognize that for some people it's just incredibly difficult. Don't turn that into a reason to blame yourself or to feel like you are less than, or why can't you handle this when other people can. I really think it's the exception when people find it easy to get off of psychiatric medications, especially the benzodiazepines. So if you're struggling with it, you're really not alone. You're really not a failure in any way. This is a difficult thing. You didn't do anything wrong in getting on these meds. I would argue even the doctor didn't really even do anything wrong putting you on them. This is just a really broken system where this is the treatments we have to offer. Well-meaning, well-intentioned, caring doctors put you on them, and you were just doing what your doctor told you to do, and here you are finding yourself stuck on these meds. So be patient and compassionate with yourself, and find your community, find a provider that can support you on this process, and take really good care. Hope that's helpful. Bye.